I'm going to go into some deeper things, and so I'm going to look at the cranial nerves, and so we're going to do a lot of eye movements now. So the eyes are midline. They work at the same column as your neck and back muscles. We know we have trauma here to the upper thoracics. We know we've had trauma to the cervical spine. So I want to make sure these are in balance. You don't have to do this. This would be sort of more advanced. I just want to give you some simple things that are very dramatic and really can show major improvements very, very fast like we just did. And then I want to get to more complex things. So if you had vertigo or you had tinnitus, you do have tinnitus, or if you had some different balance things, which you said you did at the beginning, we're starting to understand why, right? Then we would go in and we're going to do some of these other things. So what I'm going to do is I'm going to do muscle response testing. And so I'm going to come up and I'm going to use that arm again, if you don't mind, for me. All right. Push up for me. That's good. So I'd like to do accommodation first. So I want you to look at my thumb. I'm going to have her follow my thumb until it starts to converge. See the eyes start to converge right there. Now I want you to look back towards the back of the wall. Look back wall away from my thumb. There you go. There's one. Push up for me. Nice and strong. Look at my thumb again. Good. Look at the back wall. Push up. Look at my thumb. Look at the back wall. Push up. Ooh, we start to go. Not all the way, but if we did one more, you'd be gone.
Yeah.
Okay.
Yeah.
Now, mirror for gaze, that's what this is called, is that I'm going to teach you how to do this one because it's going to be important for you. So I want you to take your thumb and I want you to watch it until your eyes come together. Feel that?
Mm-hmm.
Okay, hold it there. And I want you to wait for just a second. I'm going to grab the laser and we're going to do mostly red with this. Okay, so this is neurological. So I want to do some things that are neurological. I'm going to turn the power back up. Here we go. And we're going. Now I want you to look at your thumb, and then I want you to look to the back wall. Look at your thumb, slow and purposeful, like 1001, 1002. Look to the wall or your thumb, whatever it is, and then change it. And you can feel it shifting. I can feel it shifting right now. This is the very top of the parasympathetic nervous system. The parasympathetic nervous system is two places: cranial, sacral. Cranial sacral. This is the Edinger-Westphal nucleus. It's really important in trauma. It's beginning to slow your body down so you can restore, you can regenerate, you can relax. How you doing there? How do you think you've done?
5.
Okay, let's do 3 more. So you have to be careful, especially in the neurological. They always tell you, you can't exceed the patient's metabolic rate. Now, these are muscles, right? Pupil dilating and contracting that. They're small little muscles, so you can't do a whole lot at first. She could do 3.5, 4 before she got weak. Now let it relax for me. So I'm going to let the laser do the work. So we're reconnecting. So what I expect to happen is after we finish here, that she can do hopefully 8 to 10. 10 is sort of the minimum I'd like to see. If you're treating someone like an Olympic figure skater, something of that nature, they should be able to do this 20 times. So I'm asking you to get your way to where we can do 10 times, okay. All right? So that's one. I'm going to come back and check everything at the end. So we did the Edinger-Westphal, which is the top, midline cranial nerves, parasympathetic nervous system, which is at top. All right, now we're just going to check the cardinal fields of gaze of her eyes. So push up for me. That's strong. I want you to look down and to the right. I want you to keep your head straight and just your eyes. Okay, don't let them cheat on you. Down and to the right. This is predominantly a right brain function. Push up for me. Good. I'm sorry. I do that. Thank you. Push up for me. Good. Look down and to the left for me. Push up. Good. Now look up and to the right. Push up. That would be cerebellum if that went weak. I'll explain more. Come back down to the right. Come up to the left. Push up. Good. So those are doing really well. Look just to the right. Good. Push up. Look just to the left. Push up. Look down. Push up. Look up. Push up. So all those are good. So whatever we did the first time, if we would have checked this, we might have had them off, we maybe didn't have them off. But the good thing part is that I know that when I put those inputs, it doesn't shut you down. That means we have you to a really higher level. So let's go back to the first one, near far gaze. You ready?
Mm-hmm.
Okay. All right. Bring that in. Tell me when you're there.
Okay.
Push up. All right. There's 1, 2. Look away.
I'm looking down.
Okay.
Okay.
Look away.
Okay.
3. Good. Look away. Push up. 4. 5. Good. She got one more. She's done. Push up.
You can tell.
Yeah. I could feel her fatigue, but we worked really hard. So we got a couple more. So your goal at home, this is one of your exercises.
Okay.
Just near far gaze. You can do it in the car. You can do it, when you're there. I'm not going down the road too much, but it can be done anywhere. I'm trying to say is that you can pretty much do these exercises anywhere.
Okay.
Seems very trivial. This is so powerful because, again, it's the top of the parasympathetic nervous system, and we know that's going to fire the whole column down. All right?
Good.
That's good. Right.